But I would like to give a little bit of a larger framework as to how this idea came up, um, because there are so many people who are basically uninformed, and as the person who spoke representing the pediatricians uh, uh, so clearly demonstrated, is that there is misinformation out there. Our goal is not in any way, shape, or form to induce fear or to make the assumption that our information is going to be misinformation. A lot of the information that we wanted to present to people comes from World Health Organization, CDC, research that's been done, etc. In other words, our goal is not to have an agenda; it's to simply inform people. And and I don't see how informed consent can be dangerous. If anyone in here has had um, uh, an operation, um, even if you were in your 80s, the surgeon comes in and states, well, this could happen, that can happen, this can happen, and you could die. Now, would we assume that surgeons are anti-surgery? No, they're giving informed consent. Am I anti-vax? No. I had a family practice in where myself and another physician, we had over 8,000 patients, and I have given out thousands of vaccines to our patients over the years. But then I started seeing that maybe we weren't being told everything, such as being demonstrated here. Why is there a blank sheet of paper? That's not informed consent. So the whole idea is not to withhold vaccines, and please know that I'm very sensitive to the idea that yes, people do die of preventable diseases, and I've been in preventive medicine for 30 years, and I'm very passionate about prevention. But we're not talking about withholding vaccines. That's a misplaced situation here. All we're talking about is informing so that the parents have, um, in essence, the opportunity to be informed so that they can make the decision that is best for their child. Now, what's interesting, what was brought up earlier was the vitamin K shot, and it's fascinating to me when you bring the whole idea of vitamin K. Sounds like, well, it's a vitamin, it's got to be safe, right? Well, I've got a study here it's actually from researchers who work with the World Health Organization. And I can give the reference and people can review it, et cetera. But they talk about that the benefit is for vitamin K deficiency bleeding is what it's trying to prevent. But it also states in there that that the amount of vitamin K, the incidence of that bleeding is 8 in 100,000 babies, and the shot basically reduces it to about 4 in 100,000. It doesn't completely eliminate it, but what that it also does is, you'd think, well, how much vitamin K is being given? Well, you'd think, well, maybe they need twice the daily dose or 10 times the daily dose to prevent it. Well, the amount of vitamin K that is injected is 1,000 times the amount of vitamin K that would be given normally. So, and it says in the article, and these are World Health Organization researchers, they say at that level, it's teratogenic. It can affect physiologic development. Well, why doesn't everybody know that? Why doesn't everybody know that there are some risks and benefits? And that's all we're trying to do is prevent that. And they say at the end of the article, the accurate dose there should be research as to what the dose should be. Maybe it shouldn't be 1,000 times what the baby needs. And so I think what we have done is somehow there's been so much emotion wrapped around vaccines that sometimes we're not sitting back and taking a look at the whole notion of informed consent. That's all we're talking about is providing information to people so that they can make the best decision for their child. And and how can accurate, and the key is that you're bringing up is we don't want to have misinformation. We want to have accurate information. And if the pediatricians would like to contribute to the informed consent um, information that's provided, we welcome that. We're not withholding or trying to have any agenda, just as long as there's positives and negatives, so that a mother who's busy, who doesn't have time to sit down and do tons of research, that she can just say, hey, these are 10 benefits, these are 10 concerns, or whatever, however it ends up being, the people can say, you know what, I'm a little bit uncomfortable with that, and I'm not sure I want to do that. Let me think about it. That's all we're trying to do is provide informed consent. We're not anti or withholding, and if people say, I'm just going to sign the sheet because I want this vaccine and I'm out of here, that's their prerogative. That's what they can do. But we're not trying to induce fear. We're only simply trying to make sure that we're presenting information so that people are aware that there's positives and negatives, and please make this decision. So we welcome the comments. We're not trying to go anywhere other than is everyone here informed? And if you feel informed, great. We just wanted to make sure you were informed.